Hello, everyone. My name is Lorenzo Hopper. I'm an assistant professor in the Department of Epidemiology and Community Health here at the University of North Carolina at Charlotte. Super excited to have you all join us for our February Charlotte MCH Crucial Conversation. Today's talk is entitled A Community Engaged Approach to Supporting Justice Involved Youth. If you're returning, we welcome you back. And if this is your first time with us, thank you for joining. We have a wonderful session prepared for you today that I'm really excited about. In the chat, if you could introduce yourself, maybe share your name, your agency, or like a brief connection to this topic and this work, that would be awesome. All right. As a reminder, the MCH work group is a space where we'll create opportunities for research collaborations to get involved with maternal and child health work in our community and to hear from our community members, researchers, colleagues, you all as community partners in these spaces to share our interests and our work experiences. This session is being recorded. If you have any questions for our speaker, typically we ask you to use the chat box feature throughout the presentation. We'll monitor the Q&A. Sometimes our presenters will see them in real time and may shoot an answer, or maybe they'll reserve them for the end of their talk. All right, so I will go ahead and introduce today's speaker. Really excited, y'all. Dr. April Alexander is a Metro-Line Distinguished Professor in Health and Policy in the Department of Health Management and Policy here at UNC Charlotte. She also serves as Director of the UNC Charlotte Violence Prevention Center, which provides transformative research, training, and technical assistance to communities, policymakers, and the public. Her research focuses on interpersonal and community, human sexuality and sexual offending, and trauma-informed and culturally informed practice. She is an award-winning researcher whose work has been published in several leading journals. She's the recipient of the 2024 Carl F. Heiser Presidential Award for Advocacy from the American Psychological Association and the 2025 Summer Clegg Advocacy Achievement Award from APHA, the American Public Health Association. Dr. Alexander is currently serving as the 2026 President of the Society for Child and Family Policy and Practice. She's an engaged public scholar who's been featured in numerous media outlets, the Associated Press, Essence Magazine, USA Today, and NBC Nightly News, discussing her research and advocacy work. Dr. Alexander also enjoys bringing psychology to the public through popular media and has previously contributed to Black Panther Psychology, Hidden Kingdoms, and The Handmaid's Tale Psychology. Sing off red. So without further ado, I'll pass the microphone to Dr. Alexander. Thank you for being here.
Yes, there you go. Perfect.
Perfect. All right.
Thank you.
Sorry about that. And so kind of with that conversation is where I want to talk about issues related to crime and violence at the national level and here in Charlotte. So one of the things when I go into the public and ask them the question of do they feel safe, most people say no. That we see a lot of crime posited in the media when we turn on the local news at night. We have some of these high profile incidents happening. And so a lot of us feel that we have the sense of safety that is just not intact right now. And a lot of Americans believe that crime has gone up nationally. I do have some good news, which often doesn't come from my presentations, but the good news is that across the United States, we have seen a drop in violent and property crime since the 90s. Now, we've had some blips here and there, especially after the COVID-19 pandemic, where people were distressed, out of work. Incidents of substance use were increasing, which led to things like child sexual abuse and domestic violence rates increasing. So we did have some blips in increases of crime there. But overall, we've just gotten better over the decades of reducing violent crime. Some people ask, why is that? Well, law enforcement and technology has increased. We have seen some individuals have longer prison sentences, so that has helped to reduce rates of crime and rates of recidivism. And so we've seen that across the board. In talking about youth, same thing, that we have seen this decline in delinquency cases, juvenile arrest, and detained youth across recent years. Again, this is good news in that we're really thinking about different ways of handling youth delinquency, thinking about community-based solutions to addressing youth, and so really seeing this at the national level. And the New York Times brought this to our attention just about a year and a half ago, that we have seen the number of murders reducing across different communities, particularly big cities where we often associate with higher forms of crime like Chicago, Baltimore, and San Francisco. Again, thinking about ways that we are investing in community resources and addressing some social determinants of health that predict crime. Now, in the same article, which I am cited in, they did talk about Charlotte, North Carolina, that we have been one of those metro cities where, again, there have been some inconsistencies, but saw some blips and maybe some rise in different types of crime. And one of the areas that we have been concerned about the most here in Charlotte is youth crime and violence. That we had some high profile incidents happen in the community. We've seen the rates of murders still be higher than we've wanted to see. And so we're trying to brainstorm what are some solutions to addressing youth delinquency, crime, or violence here in the Charlotte-Mecklenburg region. Over the last few weeks, there have been some, and even months, there has been some media attention to juvenile detention facilities in Mecklenburg County. And so a few years ago, Mecklenburg County had closed down one of its juvenile jails, Jail North. And so when we're seeing some of these crime rates happen and some of these high profile incidents, one of the responses has been, what if we reopen that detention facility? Me and my background in training in clinical forensic psychology and working with youth, I gave a little pause to this of, is this the actual right approach to addressing this issue of youth delinquency, crime, and violence in our neighborhoods? And is this the route that we want to go in terms of long-term change, reducing reoffending, and things like that for youth? That my career has focused on really talking to policymakers about evidence-driven solutions to reducing crime and violence, whether that's with youth or adults. Of really kind of brainstorming ways with our community partners, nonprofit organizations, practitioners, and our elected officials on what are some things that work that we know either from practice or from our own research to reduce crime and violence. And so let's do some framing of what it looks like for some of the youth that we see in our juvenile facilities. One, when we're thinking about reducing recidivism among our youth, I often take the developmental life course approach of looking at what are some things that are reducing crime and violence over time, just that are associated with human development in the human life course. This graphic right here, you've seen probably some research that has talked about maybe the trajectory of crime across the lifespan. That we see some youth who are engaging in delinquent behavior in that late adolescent phase and early emerging adult phase, but then it drops off drastically after age 25. That we've seen this across the board with different trajectories of criminal offending over time, whether it's violent or nonviolent, and then asking ourselves what is going on at age 25 for this to change. Well, we know from various developmental psychologists and other professionals, neurosciences, that adolescent brain starts working, that a lot of us engage in some moderate forms of risk-taking behavior. Some of you may have engaged in more severe forms of risk-taking behavior. But at some point in time, our brain started clicking in and said, we need to cut this out, so we have to become responsible adults, or maybe we did have some intervention. So I have worked with individuals with lived experience who have been incarcerated at different points in time. And then again, making those connections together to desist from crime and violence. And so a lot of this neuroscience research has been used in really kind of thinking about solutions to addressing youth crime and violence over the decades, that we've changed Supreme Court decisions around juvenile life without possibility parole. Here in the United States, we no longer subject youth to the death penalty if they are tried and adjudicated as youth. That was wasn't our history in the United States before, but with some of this brain science research, we have changed our tone of really treating our youth like children. Some of my work has been in juvenile detention facilities. One of my first jobs right out of grad school and right out of postdoc was a clinical professor position at Auburn University, where we had a $2.5 million a year contract with the Department of Youth Services in Alabama to run treatment programs at this facility. My responsibility, which aligns with some of my work, was working with youth who sexually offend. So we had a treatment program there that, one, provided them with rich treatment, psychotherapy, family engaged treatment, and other types of developmentally appropriate tools like gardening, sewing boot camps, just developmentally appropriate activities for our youth to keep them on track and keep them away from opportunities to engage in more negative behaviors. In that work, did a lot of assessment and evaluation, so a lot of talking to these youth about their histories and who they are and how they came to be where they are now. And one of the things that came up quite often was their trauma histories. And that there was one time where I came back from a vacation, and as soon as I came back, staff approached me about two boys who had entered our facility while I was away. And the question that kept coming up was, what's wrong with these boys? Dr. Alexander, tell me what's wrong with these boys. And I said, we do our typical assessment and evaluation, and we'll have some information back to you once we do our case presentations. And as you can see from the slide, there's a lot going on with these boys, that they've had histories of trauma, histories of family neglect, histories of child maltreatment, which led them to, again, engage with maybe some acts of delinquency, trauma after trauma after trauma. And so a lot of my reframing in my work has been, let's not talk about what's wrong with them. It's more what happened to them. And that these weren't two isolated cases, that myself and my team, we did some research on polyvictimization in these youth. So do these youth are exposed to multiple types of trauma throughout the life course by the time they reach us. And by the time they reached us in the facility, the mean age was about 15, 16. So by the time these children were 15 and 16, they had experienced, for the low polyvictimization group, an average of 8 different types of trauma. Again, we had trouble labeling that as low polyvictimization because the average is 8, seems high to me. And then if you looked at that high polyvictimization group, an average of 15 different types of trauma. We're not even talking about incidents. We're not even talking about severity. We're just talking about different types. So again, exposure to physical and sexual abuse, neglect, witnessing neighborhood violence, all the way to what you saw on that previous slide of exposure to natural disasters. So really thinking about trauma being one of those things that is connected to youth who later engage in some of this behavior. Again, not an excuse for their behavior, but it brings us some understanding of who they are in their environmental context. For girls in juvenile detention, we've even labeled this as a sexual abuse to prison pipeline, that some studies have showed that 90% of girls in juvenile detention have been sexually abused. Some people push back on me and they said it's actually 100%, but the current literature is saying approximately 90%. And so really thinking about how that shapes the developmental trajectory of these youth. What does this mean in terms of their self-concept? What does this mean in terms of their life's trajectory through the system? And then I also think about these youth who are going to school. So you're experiencing all of this in your personal life, and then you're supposed to be attending school. And we've also been talking about the school to prison pipeline, which people are a little bit more familiar with as opposed to the abuse to prison pipeline, which has us examining our school policies and thinking about ways that we are pushing out our students from the school system. So we have kids with behavioral problems who eventually get referred to detention. Maybe the behaviors reach the point to where they're getting suspended. So many suspensions get you expelled. You end up going to alternative school. The rates for kids who are going to alternative school and their outcomes just doesn't look well, and that leads to later adult prison. So we're trying to examine kind of the school policies that are being enacted that foster kids' trajectory through this pipeline, whether it's certain forms of zero tolerance policies that are being enacted, to the criminalization of relatively minor youth behaviors. That's previously to moving here. I lived in Colorado, and this article in the top left corner talks about 5,800 Colorado kids in the second grade or younger were suspended in the last year. That's wild. Of really kind of thinking about second graders and younger, going even down to preschoolers, where we're having a disproportionate amount of suspensions and expulsions from schools. And then looking at all sorts of other kind of systemic factors that are happening, and really looking at who these kids are. So we see the school to prison pipeline disproportionately affecting Black and Latino youth. Thinking about factors like the adultification of girls, that school teachers are reporting girls seeming increasingly older than their actual age. And really thinking about the impacts that that has. It results in the early sexualization of girls. Black girls are often seen as aggressive and dominant rather than being assertive for their needs. And so really kind of thinking about the whole scope of how we're treating youth in these systems and what are some ways that we can engage in repair. So for me, I want to take a collective approach to thinking about this issue. It's really easy for us to watch maybe some of these crime stories in the news and media and say, oh, that's that kid. That's not my kid. My child would never engage in something like that. And so that's a family problem. I want us to really think about it as a community problem because, again, this violence, this crime, it affects us all. And so how can we collectively get together to really examine how we can support youth and families, especially the ones who are most, we often said, at risk for becoming in the juvenile justice system. We like to reframe it as at promise, of really thinking about how we can support their needs so that they're not at risk for this pathway. And then also thinking about all sorts of other factors that come into play, that I'm also curious about the intergenerational transmission of crime and violence. That for some of these youth, they've had histories of caregivers being in the system themselves. And so really kind of thinking about what are some ways that we can disrupt those systems. Can't go into big detail about this, but these pictures are from, I was the founding director of the University of Denver Prison Arts Initiative, where we brought creative and therapeutic arts programs to prison systems throughout Colorado. So again, being able to rebuild connections between youth and families and really kind of think about how we disrupt those pathways. So over the last 2 years, I've been working on a project that was primarily focused on family engagement for youth who had engaged in problematic sexual behaviors and their families. That these youth, often who are referred to treatment services in order to address those problematic sexual behaviors, have to navigate multiple systems, and not just them, their families. And as they navigate these systems, again, there's a lot of challenges that are at play and a lot of confusing pathways and conflicting information, which makes it seem like these youth and or their caregivers don't want to be engaged in the system. We have to think about factors related to mistrust of systems that have caused historic harm to these youth and their families, and really kind of thinking about the stigma that comes with the label of engaging in problematic sexual behavior and how that carries with the family. So myself and my team at University of Oklahoma Health Sciences had gotten a grant in order to do these focus groups with a bunch of different constituents who are responsible for the care of these youth and their families. So we spoke to child advocacy centers and their staffs, multidisciplinary teams who often interact with these youth and their families, school systems of thinking about these youth are going to have to return to the school systems, sometimes where their victim is located, and really thinking about how do we keep them safe, both for them and the person they victimize, and also making sure we're reducing that stigma in the school system. They might come into contact with the juvenile justice system or the legal system throughout their trajectory. And then also thinking about factors related to their own histories. So we're starting to see a rise in youth with developmental disabilities and autism be adjudicated for problematic sexual behaviors. So we probably have a lot to talk about in terms of comprehensive sex ed and what sex education with kids with disabilities looks like, and that enters this conversation and space. We also wanted to hear the people with lived experience. So we had focus groups with youth who had graduated successfully from these programs and wanted to give their input and advice on what was needed in order to provide better family engagement. We spoke to caregivers as well, of kind of thinking about their journeys and having to help support their youth and maybe even their siblings. One of our caregiver groups was a monolingual Spanish group. So I had translators, and we were doing this virtually in order to make sure their voices were heard. And then just kind of thinking from an intersectionality approach, thinking about issues related to culture. So we wanted to talk to tribal communities and figure out how this is handled within those communities. A lot of military families in Oklahoma. So really kind of thinking about the impact and what military culture brings to this. Rural communities and thinking about the barriers to access for them in terms of quality care. And then one that I added later on because it kept becoming a theme throughout our focus groups was faith leaders. That spirituality and religion is such a big factor in people's lives that often they would go to their faith leaders about these conversations, and faith leaders often struggling on how do we handle these conversations. So we came up with some overarching themes from those focus groups, the first set being barriers. So what were the barriers to family engagement and supportive family engagement to ensure that these families succeed in their trajectory through treatment? And some of the themes that you would expect came up of really thinking about the shame and stigma that comes from being systems involved and your child being involved in the criminal legal system, and also tacking on that that child had engaged in problematic sexual behavior. So again, thinking about in tribal communities, this is your honor taken away and the shame that comes with disrespecting your family or not honoring your family through your behaviors. Also thinking about the lack of access to services. So there's little education on what do you do when your child does engage in a crime or does engage in problematic sexual behavior. Some people don't have resources and toolkits on what does that process look like for them. That are responsive or culturally responsive care is kind of limited in this area. And then another thing that came up was politics, that we're having hard national conversations about the juvenile legal system and even sexual offending as a culture. And so thinking about that being a barrier to care. Obviously, some financial barriers that a lot of individuals in the criminal legal system often are from low socioeconomic status. So really thinking about how that impacts them. And then for the agency serving them, we're having a shortage of grants that are allowing us to do quality work in this area. And the problem is growing even bigger by the day. For our families, they encourage us, can we see the world through their eyes and really kind of think about how hard it is to navigate these systems. For the youth, again, they're still in their developmental adolescent period and trying to figure out their own identity. And so really us reflecting on what that looks like even when we were growing up. And for the caregivers, they also reflected on, can you imagine being a parent going through this and what that could look like for you? Linguistic services are still limited. So thinking about that linguistic barrier, and not even just in terms of language, but in terms of terminology, that a lot of us like to use a lot of jargon and lingo. I've probably done it during this presentation, and really kind of thinking about our families and them having trouble understanding all these nuances in the system and just learning how to navigate it. And then part of our focus groups wanted to address culturally responsive care. And a lot of our clinicians, whether it was the multidisciplinary teams or the CACs, said there's just need for better culturally responsive care training out there. And so we had our focus groups also identify some responsive solutions. So taking time to just listen and hear people's stories, that their journeys are complex and we can't expect people to heal or accept accountability for their behavior overnight. Sometimes there's a pressure for adolescents in treatment to do that, but we have to recognize kind of the developmental course that goes with treatment. Also, representation matters when it comes to culturally responsive care. So do you have clinicians who look like you and shared identity and shared values as you? And so learning to navigate that. Trust, honor, respect came up in so many different ways throughout our focus groups of how can we have mutual respect for one another and again, our journeys of life and what we're going through. And then in a lot of our treatment programs, we often have one-size-fits-all care, which just does not match the families that we're serving. So that need for aspects of individualized care. Maybe for us as providers and us as healthcare professionals, kind of thinking about how we need to engage in lifelong learning. So when it comes to culturally responsive care, how are we kind of taking a step back and really reflecting on our needs as professionals in training? This also helps us to think about ways that we can engage in trust with the youth and their caregivers, and recognizing that trust takes time. A lot of the youth and caregivers said eventually, once they got over that hump, they loved their clinicians, they loved all their providers, and recognized kind of all that they were providing to them. It was just, again, the systems require us to demand so much of these families right away. We want to see the whole of the child in the family, that this child is not their worst mistake, that there are a lot of strengths within that child and their family that we need to reflect on, and how can we bolster that. And through that, relationships matter. So thinking about the importance of connection. So as we kind of think about youth crime and violence, really, I'm still writing up the manuscript for this, so thinking about my discussion, really kind of thinking about these themes and how they all reflect the need for community care to support these youth. In our system, the need to see them from a developmental lens, the need to think that they can grow and thrive was just so important, came out from all of the professionals that we interviewed in this process. You know, coming back to Charlotte, one of the things I had concern about was hope for a jail returning in the use of that language. And so really us reflecting, is that what we hope for youth to be in these carceral systems? And can we hope for something else? And so I think through the years, I have a liberation mindset, and I've been reading a lot on the concept of radical hope, of can we re-envision and think of something new? And I'm hoping during our discussion, that's the spirit that we're going to carry today. That radical hope has been this framework that has been useful in kind of thinking about culturally responsive ways to engage with youth and their families. And for me, envisioning possibilities is one of those prongs of radical hope that I want to see in our future work. That I do not hope for a prison. I do not hope for a jail. And so really kind of thinking about what are some of the possibilities out there to protect our youth. There's been conversations of third spaces. So thinking about growing up, what were the things that kept you healthy and happy in your community? So me reflecting on roller skating rinks in my childhood. Some people in the chat know that I was a bowler my whole life, and really thinking about that being an accessible space, an affordable space back then for people to convene, particularly teenagers to convene, that was safe and healthy and happy. So there's been this conversation about the loss of these third spaces in communities all across the country. You might have seen the TikTok video I did when it was released that night of the incident in Birkdale of young people out dancing and having a good time, but some disturbance. They were getting on top of cars, and I said, that's where you blew it. And then I knew right away, I said, the adults aren't going to be happy about this. And right away, the next morning, we had curfew being initiated in Birkdale Village. But you see the other article, the teens are like, well, we're just going to move somewhere else. Again, do we have spaces for them to engage in fun activities where they're not going to be punished, that they can be safe, so they're not going to be at risk for being hit by cars? So again, things that we need to continue to think about and really foster the ability of nonprofit organizations and other community organizations to create these spaces. Me and my friends in Colorado created a summer camp one time to offer space to young kids to engage in pro-social activities, learn about their identities from a freedom school model. And so really thinking about how we can offer spaces like that for our youth. And then lastly, just kind of going back and thinking about those social determinants of health that do predict youth violence. We can't talk about stopping youth violence if we're not talking about issues of affordability, housing, homelessness. So really thinking about investing in all of those underlying factors in order to support youth and their families, we're going to see that reduction in crime. Are we investing in affordable or no-cost treatment for our youth who've experienced violence, who've witnessed violence, who've experienced trauma before? So my hope is we need to reimagine and re-envision some possibilities for our youth that are not punitive, that are transformative, that are supportive, that are nurturing, and really thinking about this from a collective approach to solving this issue of crime and violence. So I want to thank my colleagues again in Oklahoma for their collaboration on the side of the focus groups to provide new insights into our work. I want to thank you all. You'll have my contact information along the way to continue these dialogue. And then I hope that you follow the work of the UNC Charlotte Violence Prevention Center. Again, youth violence is a sliver of our portfolio, but a meaningful one, in that we're here to really kind of think about solutions and think about how we can continue collaborating as a community to address these issues. We have our own speaker series really invested in professional development for healthcare professionals to offer continuing education credits. Our next one coming up is focused on affirming care. Again, culturally responsive practice is a passion of mine. And so really thinking about ethical considerations in providing affirming care for LGBTQ individuals. And thank you.
All right. What a wonderful presentation. If we could in the chat maybe react. I see some reactions coming in. I'll send my clapping hands now. Thank you so much, Dr. Alexander. We would now like to kind of open it up for a Q&A. Before we do so, I will stop the recording.